Filgrastim, colon-stimulating factor, hematopoietic agent, used to decrease the incidence of infection, neutropenic fever, in patients with non-myeloid malignancies receiving myelosuppressive chemotherapy associated with significant incidence of severe neutropenia with fever, and to decrease the duration of severe neutropenia in adult and pediatric patients more than or equals to 1 month of age with non-myeloid malignancies receiving myelosuppressive chemotherapy associated with clinically significant incidence of neutropenic fever, and to reduce the time of neutrophil recovery and the duration of fever following induction or consolidation chemotherapy in adults with acute myeloid leukemia, and to reduce the duration of neutropenia and neutropenia-related events such as neutropenic fever in patients with non-myeloid malignancies receiving myeloablative chemotherapy followed by marrow transplantation, and to increase the survival in patients acutely exposed to myelosuppressive doses of radiation, and used for mobilization of autologous hematopoietic progenitor cells into the peripheral blood for apheresis collection, and used as long-term administration to reduce the incidence and duration of neutropenic complications such as fever, infections, oropharyngeal ulcers in symptomatic patients with congenital, cyclic, or idiopathic neutropenia. Off-label use, used for the treatment of severe alcoholic hepatitis and for the treatment of Fanconi's anemia-associated neutropenia, and for hematopoietic cell mobilization in healthy donors for peripheral blood stem cells for allogeneic transplantation, and for hematopoietic cell mobilization prior to beta-glucan autotem cell in beta thalassemia, and for myelodysplastic syndrome associated anemia, and for neutropenia in advanced HIV infection, and for non-chemotherapy drug-induced neutropenia. Mechanism of action: Filgrastim is a granulocyte colon-stimulating factor, GCSF, produced by recombinant DNA technology. GCSF stimulate the production, maturation, and activation of neutrophils to increase both their migration and cytotoxicity. Onset of action: transient increase in neutrophil count is seen 1 to 2 days after filgrastim initiation. For TBO filgrastim, time to maximum ANC 3 to 5 days. Duration: filgrastim neutrophil counts generally return to baseline within 4 days. TBO filgrastim ANC returned to baseline by 21 days after completion of chemotherapy. Half-life elimination: neonates 4.4 plus or minus 0.4 hours. For adults, filgrastim 3.5 hours, TBO filgrastim 3 to 3.5 hours. Time to peak: for subcutaneous filgrastim 2 to 8 hours, TBO filgrastim 4 to 6 hours. FDA approval date is February 20, 1991. Filgrastim chemotherapy regimens: for bladder cancer, cisplatin, docetaxel, gemcitabine, and MVAC. For bone sarcoma, Ewing sarcoma, cyclophosphomides, topotecan, docetaxel, gemcitabine, ifosfamide, carboplatin, etoposide. For bone sarcoma or osteosarcoma, docetaxel, gemcitabine, ifosfamide, carboplatin, etoposide. For breast cancer, AC protocol. For endometrial cancer, cisplatin, doxorubicin, paclitaxel. For esophageal cancer, paclitaxel, cisplatin. For acute lymphocytic leukemia, CalGB 900, CalGB 9111 regimen. For acute myeloid leukemia, CLAG, and clofarabine, cytarabine, and the FLAG IDA. For chronic lymphocytic leukemia, bentostatin, cyclophosphamide, rituximab. For Hodgkin lymphoma, BIACAP 14, BIACAP escalated plus standard, DHAP, ESHAB, ICE, and IGEF. Non-Hodgkin lymphoma, EPOC, dose-adjusted rituximab. Non-Hodgkin lymphoma, PERCT, CODOX M-EVAC, and hyper-CVAD alternating with high-dose methotrexate, cytarabine, rituximab plus CNS prophylaxis. For non-Hodgkin lymphoma, DLBCL, RICE, and for non-Hodgkin lymphoma, mantle cell, cladribine, rituximab, and rituximab hyper-CVAD. And for multiple myeloma, DT-BASE protocol, and for soft tissue sarcoma, and docetaxel, gemcitabine, and iberubicin ifosfamide. And for soft tissue sarcoma, rhabdomyosarcoma, cyclophosphamide, topotecan, and for testicular cancer, TIB or TEP, and VIB or VEP. And for unknown primary adenocarcinoma, carboplatin, paclitaxel, and for uterine sarcoma, docetaxel, gemcitabine. Uterine leiomyosarcoma, docetaxel, and gemcitabine.